Hi everyone, welcome back to another episode of Dementia Discussions brought to you by the Alzheimer's Association. We're so excited to be back with you and joining you to explore different topics about dementia. My name is Lisa Sobian. I'm a volunteer with the Alzheimer's Association. I'm also the Director of Dementia Services at Duval Life and Wellness Community in Lowell, and I'm here with my co-host, Christine. Hi, Christine.
Thank you, Lisa. Hi. My name is Christine Bunnell, and I'm here from the Alzheimer's Association. I'm the Regional Manager for Greater Boston and Northeastern Mass and work on our program team, and really glad to be collaborating on this with Lisa. And we're thrilled to be joined today by Dr. Jonathan Jackson.
Hello.
Thank you for joining us.
Hi.
Excited to have you.
Glad to be here.
We're really glad to dive into a little bit of a discussion about research related to Alzheimer's disease, but also about a research project that Dr. Jackson is involved in, the All of Us research project too.
Yeah.
So thank you so much for joining us.
Yeah, thanks
for being here
having me.
today.
Yeah, this is great. I'm really excited to delve into all things research with both of you and kind of talk about some of the latest really exciting scientific findings, both for the All of Us research program, but also in talking about dementia and Alzheimer's disease. 2020 is going to be a big year for science.
Oh, that's great. Good to hear. Yes. So I think one of the things we wanted to start with, just to lay some framework so the audience and people listening know about the All of Us research project and program, what it is. Can you tell us a little bit about the program?
Of course. So the All of Us research program is a really exciting new initiative. It's been around in various forms for a couple of years, but it's really ramping up now. The idea is that it focuses on this new branch of science that's called precision medicine. And the idea is pretty simple if you think about it. So, Lisa, you and I are both wearing glasses, and we have to go and get a prescription from our eye doctor. And if we swapped glasses, our vision would probably be worse. So the same thing should be true of our healthcare. Shouldn't the medicines that we take also be tailored specifically for us? It's kind of an easy question, and it's one of those things where yes, like if I wear a size 8 shoe, then I expect to be able to go to a store and find a size 8. We should have that same level of specificity when it comes to our treatments. And so the All of Us research program is designed to get 1 million people, at least 1 million people on board, try to find out exactly what makes each of us unique, and then use that as the basis for the next generation of medicines that will be tailored to each and every one of us.
Sounds very inclusive.
Yes, yeah, the idea is that we really need people from all walks of life. So the sad truth of the matter is that when it comes to most medical research, the stuff behind any of the medicines that we take today, is that it's really based on a very narrow population. So the vast majority of us are not usually counted when we're designing new therapies. So All of Us is hoping to change that, and that's where everyone else comes in. So yeah.
So what happens when somebody is in the program?
Yeah, so I like to think of All of Us as one of those gateway research studies. So this is not your grandfather's research experiment where you're kind of a lab rat and somebody in a white coat is looking at you with a clipboard and doing sort of awful things to you. So all
through
of us
through a two-way mirror.
Exactly. It's a much easier, I dare I say it, even fun experience. So you come in to a visit and you talk to somebody who's really enthusiastic about the project. So it might be somebody who looks like me or somebody who looks like you. But the idea is that we take a little bit of a blood sample. We kind of look at your height and weight. We ask you some questions. We ask you to sign up for an app, and we follow you, using surveys that you can answer on your smartphone in about 5 or 10 minutes. And if you're willing to do that every few months, then we find out a huge amount of information, and we use that information to tailor the next generation of therapies for you, for people who are like you, people who have had your experiences. So the more that you sign up for, the more that you participate, the more we know about what you need when it comes to life-saving therapies. So it's a really easy, kind of a low lift in terms of research participation. You come in for one visit that takes maybe an hour, and then we ask you to fill out some surveys a couple of times a year, and that's it. We also pay you $25 for your time. So
So it sounds like a great conversation people should be having at dinner after they watch this with their loved ones about signing up, and the benefit of that. Do it as a group, and we should all do that. And that's it sounds so painless.
Yeah. No, it's a really easy. But the idea is that we get so much crucial information that we just don't have right now. So, before we were filming, we were all talking about the different ways that that medical research has fallen short for all of us. So we know that when it comes to heart disease, it was mostly based on men for a number of years, and when women present with those symptoms, they weren't being recognized in the clinic, and they weren't being recognized in research studies. So just being a woman means that your voice needs to be heard. So All of Us is a great way to get involved. And what's best about something like All of Us is not just that you're giving information to sort of stuffy scientists who are thinking about how to tailor medicine to you. We're giving that information back, and we're making it publicly available starting later this spring. So I'm going to be working with the All of Us team to spearhead a series of public conversations where we show you how to access this data, and you can find out answers to your own burning research questions about what you need in terms of healthcare. What hypertension looks like in your community. So we've never had that level of detail before, and if you don't sign up, if your community doesn't sign up, then you won't be able to. You won't be able to access that information. So. Everyone else is going to be doing it. You might as well do it too. So.
That's a good message for it. Well, it sounds empowering too. Like you're saying, to have that level of information about yourself or your community, and then I love the educational component that you're talking about, to then give that back to say, oh, this is what my number might mean, or a number for someone who looks like me might mean, and how do I then advocate for myself maybe.
Right, and so the idea is that we won't have all of the answers, we also won't have all of the questions.
Sure.
So if you're going to be providing information for this, shouldn't you have the right to know what's in there? Shouldn't you have the right to know what your community looks like in terms of its health? And so the idea of this is that it really drives what we call citizen science, where people who don't have to have the fancy degrees or work at the fancy hospitals or fancy universities can still get down and look at the information and understand what kind of changes they need to make in their community, what kind of opportunities they can look for, and all of this is possible through the All of Us research program. It really is a fantastic opportunity.
Well, I loved when I was looking on your website how it talked about the precision medicine and looking at not just the person's genetics but their lifestyle and the environment, and so that where you live exactly, and what your habits are, because you might have people, they might, I guess, look at people with these particular similar habits, what happens with them, and how does that work? And I'm curious how this then interplays in terms of how it's going to help with dementia and
so
partnering with the Alzheimer's Association.
One of the really great things that we've learned in the last 10 years, so it's sort of a new decade, we're kind of taking stock of where we've been, is we've learned that old nature versus nurture debate is not really so much of a debate. So the truth is that there is nature and nurture, there's genes and the environment, and they work together. So you can have these things that are related to genetic risk. So if we're talking about genetic risk for Alzheimer's disease, we know that there are 3 genes that are highly predictive of risk. So presenilin 1, presenilin 2, and the amyloid precursor protein. If you take any genetic test, they'll tell you what your alleles look like for these genes. But we know that there are other genes that kind of confer risk. So if you have a mutation on these genes, it doesn't guarantee that you'll get it, but it may change your risk. And so the big one that most people know is called ApoE. And if you have the ApoE4 allele, then supposedly that increases your risk. But what we're learning about the world of precision medicine is that it doesn't increase your risk for everybody. So for Black and African Americans, ApoE4 does not seem to increase their risk for the disease.
Wow.
So instead, there's another gene that is important for Black and African Americans called ABCA7 or ABCA7. And so we know that if you have a mutation on that gene and you're African American, it modifies your disease risk. So the era of precision medicine shows us, how these things are important. So we know that if you have some of these genetic risks and you live a certain lifestyle, and if you're a certain race and ethnicity or even a gender or a blood type, then it may be important, but not for everybody. So it's really important to get involved with programs like All of Us. It's really important to get involved with dementia research so that we understand not just whether treatments work for everybody, but whether your risk is really what we kind of think it is, based on what we know about certain genes and environmental interactions.
That's really
interesting.
It is really interesting because you can think that you have a particular risk when maybe you don't, or maybe you have a risk you didn't realize you have, and you can tailor. The Alzheimer's Association works so heavily on prevention and brain health, and you want to be targeting what you need to be working on.
Sure, and for the right person. I
Right.
think this individualized approach is so
That's great.
empowering and impactful. And I think with research too, one of the things that we hear as a challenge with research studies in the community and try to talk with the community about the importance of clinical trials is also sometimes a barrier for moving research forward is participation.
Oh boy.
And that million, the goals I think are high and important to be high, and not just enrollment, but also people staying in the study too. So I wonder if there's anything you want to say about that, if that's been you found that to be true in terms of being a challenge with research.
Oh goodness, how much time do you have? No, the truth of the matter is that participating in a research study, staying involved in a research study, these are the really big bottlenecks to driving research forward.
Yeah.
So when I was a kid, they would always say, oh, we're cutting down the Amazon rainforest. Who knows what cures for cancer are in there? Or, we haven't explored the bottom of the ocean. Who knows what cures for various diseases are in there? Yeah. The fact of the matter is that there are cures for diseases that are in clinical trials, and they're not getting anywhere because people aren't signing up.
Yeah.
People aren't being able to, or worse, people are signing up and then they're not sticking with the study. So we know that something like 11% of all clinical trials, so these are possible cures that are being tested by scientists that if they work, they can be available within a year or two to anyone who needs it. 11% of those don't recruit a single individual.
Wow.
And we know that 80% of research trials don't finish on time. So even if there is a drug that's being tested, even if we know that it's working, we need to get people involved in the research study, because if they don't, it drags it out. And so 80% of trials don't finish on time. And the vast majority of those trials, when they do get their enrollment, it takes twice as long as they thought.
Wow.
So if you imagine, a cure for a disease that's just trying to get through clinical trials, we think it'll take 2 years, but it actually takes 4.
Wow.
And all of that is due to people
Yeah.
not signing up, not being able to stick with the study.
Sure.
Time is time is
So
golden.
It
Yeah.
really
Yes.
is, and the fact of the matter is that is I think that's going to be the single biggest bottleneck for research. And so we're talking a little bit about precision medicine, but I also know that in the era of dementia treatments, we're facing an explosion of possible treatments and cures that will be tested over the next few years. 2020 is going to be a banner year for announcing whether these drugs work or not, but it's also going to be a banner year for trying new and completely different things beyond kind of the standard set of therapies that we've been working with over the last 10 years. The only thing that will hold us back in terms of not announcing one cure, but several cures, and maybe even a cure that will work for you or a loved one or someone that you know, is going to be people signing up and sticking with research studies. So that is honestly the single biggest barrier to advancing medicine, especially into the dementia space.
Sure.
So it's such a crucial issue.
So how do people kind of get involved with this?
Yeah, so I mean we're online. You can go to www.joinallofus.org. There's actually a special New England one, so we've got like a little bit of New England pride. So if you go to joinallofus.org/New England, then you'll be rooting for the home team there, because we like to compete with each other and we want to be best.
Who doesn't in New England,
of
right?
Course. So I mean, New England's the best at everything. She might be best at this too.
Yes, yes.
But if you prefer to kind of call us, there's a few phone numbers floating around. The easiest one to remember is 617-768-8300. So that's 617-768-8300.
And we'll post these.
And so we'll make sure that these are posted.
Yes.
But give us a call. Tell them Jonathan Jackson sent you. But the idea is that we want New England to be on the map with precision medicine the way that it is with everything else. So there are new possible cures that may be announced as early as this year for Alzheimer's disease. These drugs were developed by companies headquartered in Boston, in Cambridge. So we want to stay at the forefront of everything. So we should really be involved with the All of Us research program as well.
I think we have a video that we want to
I think maybe
share.
that would be great.
It's a great time to
I think to segue into that and just talking a
Sure.
little bit about the All of Us research program and
I think that would be
follow
wonderful.
up on what Jonathan just shared with us. So we'll show you that as a quick clip.
Meet Ray. Ray lives on a farm. He loves playing kickball with his grandkids, but lately he's gotten a little slower and been visiting the doctor a lot more often. This is Kim. Kim lives in the city. She loves to exercise, cook healthy meals, and can't remember the last time she called in sick. They're both people, but not all people are the same. And yet, when we visit the doctor, our treatments don't look that different. Why is that? Because we just don't have enough information to do it better, until now. Enter all of us. The research program based on precision medicine. Precision medicine is a revolutionary new approach to treating and preventing disease that's personalized instead of one size fits all. By gathering health data from 1 million people like Ray and Kim and Trevor and Samir, our country's best researchers will be able to develop treatments that are as unique and complex as we are. With this new information, doctors will have a better understanding of disease so they can innovate the next great breakthroughs in medicine. Once enough people join, suddenly everything changes. Information becomes clear, patterns emerge, and simple data transforms into life-saving knowledge. This means that Ray and Kim's children and their children's children can live longer, healthier lives. By becoming one of the first 1 million people to volunteer, you can help reshape the entire future of healthcare for generations to come. If we can figure out how to fly, put a man on the moon, and connect the entire world, surely we should be able to improve the future of healthcare. Not just for Ray and Kim or even you, but for all of us. Sign up at joinallofus.org. The future of health begins with you.
All right, and we're back. So that was a great way to hear a little bit more about the All of Us research program. And I think a great piece that you were just talking about before we watched the video too, Jonathan, was about the broad scope of research that's going on in dementia-related research. And we're really excited at the Alzheimer's Association, a program that we have to help folks in the community get involved in research is our Trial Match program,
of course.
Which I'm sure you're familiar with. And it's a great program. I think people, a big question that I often get in the community is, how do I get involved? I think that barrier to getting involved in research is also for people to find out, what is going on in my area. And in New England, specifically sort of this greater Boston area, there is so much going on.
And needing healthy people for these for the trial match. I think that's something that is almost very, very similar to all of us, because you want kind of people in there every day participating, because the first person who's going to be cured is not the person who necessarily has it now, but potentially.
So, and I think that's a really important piece about research too, that we try to encourage people, whether they're living with the disease or a care partner or not currently living with the disease, to really encourage that involvement and interest in research. And Trial Match matches people with clinical trials that are going on. You can call our helpline to get involved in that, and we'll share that helpline number.
And you can do both.
You can do both.
Yeah. I'm signing up for both today.
Oh, good, Lisa. We'll hold you to that.
Yeah, hold me. Next segment that we do, I'll be able to report that I've signed up.
Okay, that's fantastic. You can tell us about your experience.
That's right. That's right.
But you both are absolutely right. Getting involved with the Alzheimer's Association is something that I always recommend for people who are living with some kind of dementia. It doesn't have to be Alzheimer's, as we all know. But if you are facing a fear or a concern about that, it helps to connect with the association. Trial Match is by far the easiest way to get involved in Alzheimer's research. Definitely talk to your doctor or nurse practitioner or clinician about it. But the idea is that 2020, like I said, is going to be a big year for announcing new therapies, some of them which are homegrown. But the idea is that we're moving into an era of primary and secondary prevention, which is fancy words of we're going to try to stop Alzheimer's before it starts. And so we've made a huge strides in terms of defining what that looks like and figuring out who we need to talk to and how we need to get them involved. But the fact of the matter is we need now easily 600,000 people for dementia research alone. And the vast majority of those people do not need a formal diagnosis of mild cognitive impairment or of Alzheimer's disease or any kind of dementia. They need to be healthy adults who are middle-aged and older to let us know, if we give you this drug and you take it like you take your Lipitor every day, can we prevent you from having Alzheimer's disease the way that we can prevent you from having a heart attack?
I believe, doesn't Trial Match have things too where you can, it might be questionnaires, it might be somebody who's isn't necessarily worried about a risk, but just wants to participate in that. So,
and I think to Jonathan's point, I think about the a little myth busting that you did with all of us before. It's not just research that is a medication or you're hooked up to anything. It could also be questionnaires, much like the All of Us research program.
Yeah, exactly. And honestly, the biggest research finding over the last decade was in terms of the dementia and Alzheimer's space was how diet and exercise could really lower your risk. And so there are a number of studies on Trial Match that help you have like the Mediterranean diet for 8 weeks.
Wow.
Or help you sign up for a gym at your local YMCA.
Do they send the chef
months.
to the house?
I wish.
That'd be great.
Second phase.
That's right. You can extend the study.
There we go.
But the idea
Some
is that
seed funding.
is that all clinical research, especially research that's designed to prevent dementia, it's not just about like having a tube in your arm or having to take a pill. It's about the things that you can do, things that maybe you want to do at the start of a new year or a new decade, and you're trying to keep those resolutions.
A little encouragement there.
Right. You might not think of Trial Match being able to help you keep your New Year's resolution about going to the gym, but
I like this segue here, Jonathan. Yeah, there you go.
So I definitely recommend if you feel like you want to be involved in the space or contribute, it's better than donating money. Through these year-end drives or something like that, being able to sign up for a research study and giving back in that way is the ultimate gift, because it doesn't last a lifetime. It lasts generations. It lasts centuries, because we build the next set of therapies on what's come before. And so this is the gift that keeps on giving. And there is definitely a research trial that fits for each and every person, each and every lifestyle, each and every level of cognitive status, each and every age or a kind of time of day that you're available. There's definitely a study for you, and all of it is really, really vital to helping the fight against Alzheimer's
and
disease.
helping to leave that, in some ways, another gift to leave for your children, if you have children, because something may not be discovered right now, but it's you're building up to that point where when we have all these great wonderful news to announce, when we've gotten to great places with this disease, that it can affect the next generations, which is so important.
Yeah. So to the extent that we can maybe tell our children or grandchildren that Alzheimer's is something that is treatable, and something that you can still have a great quality of life. It will, because of it's going to be down to moments like these, years like this, years like 2020, when people who are watching this sort of stood up and said, I want to be involved, and it's only going to be because of people who are watching this video or thinking about clinical research opportunities that will be able to say those things. It won't be because of fancy scientists like me. It'll be because there are volunteers who are willing to give their time to give back through the gift of clinical research.
Right. Unless you too are involved in a research study.
Does
that preclude you?
No,
That's good.
So I'm not eligible for any dementia studies, but actually I do a number of research studies on hypertension. I don't have HIV or AIDS, but I volunteered as a control subject for some of that research, and so it's a great way of giving back. And I learned a lot about myself. So I actually, one of the really great things about participating in a research study, no matter what way that you do it, is you learn a lot about your own body and what's going on. So actually I learned that I had lead poisoning
where
I was living, because I was taking part in a clinical research study. And they returned results to me. I was able to see that, like some of my levels were really weird, and I talked about it with my doctor, and she was like, "Oh, it seems like you might have lead poisoning."
Wow!
But
so
you're a
very
grown man.
Indirect.
Testing for that when you're like sick.
Again, the idea is that you end up with this, this very close level of monitoring. The research study had nothing to do with lead, had nothing to do with lead paint or anything like that. It was just a perk.
What a happy accident!
Yeah. So it's one of those things where the gift really gives in lots of different ways.
I think it would be helpful to just mention too to our viewers that all of the information that's collected for Trial Match and collected for All of Us is not sold to any. It's maintained the privacy of people, because people are always concerned about that.
Yeah, and I think that along with what you were just sharing, Jonathan, are great questions, I think, to empower people to ask when they get involved in a research study, how is my information used? And also, how is that information given back to me? Because I know for some research studies, they may not share as much. Happily, Jonathan was told about his lead poisoning, but I don't know if that always happens, but good questions to sort of empower people, I think, when they're getting involved as well, to ask.
Exactly. The rule to follow is that if you are not comfortable with every aspect of research participation, don't do it. Just don't sign up for it. But you should also demand more, demand better. All of us is committed to returning genetic information to the vast majority of us participants. We're going to be returning a lot of other study information to you. What's great about all of us is that you get to choose what you get back. And we're not going to just give you a data dump. We're not going to withhold everything from you, but you actually get to pick what you hear about, and you'll get to pick when you hear about it. So it really is this empowering study where you get to find out information it's much higher quality than doing something like 23andMe. So, what's great about all of us is that we pay you for your time, and we give you much higher quality data than you can get from a lot of the genetic testing companies. And then we also, of course, completely protect your data. It's protected from with a certificate of confidentiality. The federal government can have access to your data. We don't give it to police. Police departments, we don't give it to pharmaceutical companies. It's just for you, and and then in the aggregate, it's just for research scientists to find new cures for things. That's so, amazing. The idea is that the data collection and the release of that information is always on your terms. It's very empowering. You get high quality data, and that is completely confidential.
That's great. Thanks, Jonathan.
Jonathan,
and
thank you.
I think one of the things I just wanted before we wrap up, I'd love to hear, because I know we were talking with some excitement about 2020 being a big year for dementia, and talked about some of the lifestyle things that over the last decade, I guess, have been impactful.
Right.
What would you say with dementia, this to put you on the spot, but dementia-related research, what are you kind of most excited about to see what's coming forward, or what you anticipate we might see in this next year with dementia-related research?
I think any neuroscientist, neurologist worth their salt is looking very closely at the company of Biogen and their FDA filing. So this is sort of the last major step to see if a new drug for Alzheimer's disease will be approved this year. So Biogen announced that they were going to give this a shot last October. And so we'll find out sometime this year if the drug that they thought initially failed, and then later, when they kind of realized that they had a more diverse research pool than they realized, made some adjustments to the data and found out that it worked. We'll see if we have the first new therapy since 2004 for Alzheimer's disease. So that's the biggest news of the year. But what's also around the corner is the fact that in the Alzheimer's and dementia space, we're now trying lots of different avenues. So most of the therapies have been focused on this beta amyloid, this peptide that's in your brain that kind of goes wrong in Alzheimer's disease. But now we're looking at tau, we're looking at lifestyle, we're looking at the fluids in your brains, we're looking at the stuff that's happening in your gut, your gut bacteria. We're looking at
second brain.
Yeah, exactly. We're looking at all kinds of different things in the dementia space. So 2020 is when a lot of those studies will launch. And so if you are kind of over the amyloid hypothesis, like kind of our standard theory of Alzheimer's disease, this is going to be the year where we'll get to test out some of those new these new theories and these new therapies in research studies.
And you can always find that information on the Alzheimer's Association website. There's a ton of information there.
The association is very, very deeply involved in a lot of this research, and so that's the best place to go to find out more.
Yeah.
And not only with that, but with some of the other programs of the association. I think it would be great, Christine, if you wanted to mention some of the programs that we have.
I think a great way of just to thank you, Jonathan, for being here with us today, for talking about all of us, talking about research in general and also related to dementia. And if anyone has any questions about any of the topics that we talked about today, certainly know that you can reach out to our 24/7 helpline anytime. That's a program that's available, like the name says, 24/7 through the Alzheimer's Association. And the number to reach us is 800-272-3900, and that's a gateway to all of the programs and supports that we offer. So certainly to learn more about research, but to find out about education programs in your community, to talk with professionals who are licensed, master's level clinicians if you're going through a care planning or a care delivery crisis, or just looking to learn more about the disease, as well as access to support groups, which Lisa facilitates in the community, and just maybe to get connected with others. There's no no wrong door to come through our helpline, so please don't hesitate to call. We're also happy to direct people through the helpline to our trial match program.
And if you're interested in volunteering.
Or if you're interested in volunteering, like Lisa, great. That's a good plug
a great
too.
Opportunity.
2020, lots of new resolutions, clinical trials, volunteering, changing our lifestyles. We got a lot to do. But we're so grateful again for your time today, and we'll make sure that we have our helpline as well as all of us research information up here for you to get in touch with any of us. So,
and if you have any topics that you're interested in for Christine and I to explore in our next sessions, please reach out and let us know. We would love to, tailor-make what people are interested in.
Sure, that's a great point. Thanks, Lisa.
You're welcome.
Great. Well, thank you guys again.
Yeah, thank you both. Thank you, Lisa. Thank you,
See
Christine.
you soon.
Thank you.
Thank you. Thank you so much, everyone, for joining us today on another installment of Dementia Discussions brought to you by the Alzheimer's Association. We're so glad you could join us, and we look forward to being back with you again soon.